Center of the Philippine Foundation for Vaccination. And hopefully we will be able to get a very active, very provocative, if you wish, but we do hope that we would be able to answer the questions that are burning in your minds. Now we have a set of very distinguished people here, and I'd like to introduce to you these people. On the far left is the president of the Philippine Foundation for Vaccination, which was established 20 years ago to be the voice for vaccine advocacy. And that is Dr. Shelly Ann de la Vega, a champion not just for vaccines, but also for geriatrics. I don't see any one of you who are geriatrics here, except me and maybe Dr. Tayag. But rest assured that actually she is so much in not just for vaccines for the elderly, but also for the welfare of the senior citizen. She's actually the champion also for the welfare of our senior citizen. That's Dr. Shelly Ann de la Vega. Next to her is the representative of Congresswoman Vilma Santos Recto, who couldn't make it. She's in Congress right now. But in her place, she has appointed Dr. Magsino, the director of the Mary Mediatrix Medical Center, and has been very good. President. CEO. Okay, CEO. You have so many titles. Okay, so sorry, I'm also a senior citizen, so excuse that. But Dr. Magsino is the representative of our keynote message giver, Congresswoman Vilma Santos, who couldn't make it. And I'm sure he would be able to share with you some problems on also vaccine hesitancy. I will not introduce the person in the middle, but go back here first to Dr. Benito Atienza, who is the overall chair of this 20th Philippine National Immunization Conference. He is the vice president and future president of the Philippine Medical Association. And it's about 100 years old already, right? 116, the Philippine Medical Association, which is the umbrella organization of all the doctors in the Philippines, which I heard is counting 87,000 doctors in the Philippines. So you had, wow, the most number of members in terms of membership. 87,000 doctors in the Philippines. Dr. Benito Atienza, overall chair of our 20th National Immunization Conference. Here is, of course, no need for introduction, the dancing would-be Secretary of Health. You know, if he did not become so popular with his dancing, and he got people threatened by his dancing, he would have been, but because of that. But you know, he dances for a cause. Of course, no one will ever forget the dancing king, Dr. Eric Tayag, Enrique Tayag. And
good morning.
He's been the chief of epidemiology. He knows all about what we need to do to make sure that the polio and measles that we are now suffering from, this could have been avoided were it not for some pitfalls, and he would have known all along because he has been there as epidemiology chief of our Department of Health. He knew all along what would have happened, you know, but some people don't, so that's the problem. And in the center stage, of course, is the president of the Philippine Medical Association, Dr. Jose Santiago. He is a family physician and has been doing so much for PMA. In fact, right now, his theme is build, build, build PMA, and he has been increasing the strength of PMA by activating much more the Filipino doctors. Before, they used to just dance and thing, but now they're doing so much also for the Filipino patients. So please welcome Dr. Jose Santiago, President of the PMA. So ladies and gentlemen, we are going to have a question and answer, But before all that, I really want to just, for opening, our topic for today, and the topic and the theme of the Philippine National Immunization Conference is, of course, vaccine hesitancy. Why are we here? To really talk about what is happening to our country. Did you know I've been traveling a lot in the past few months? Not because I wanted to, not because I'm really retired. I'm a senior citizen. For I'm almost 70 in a few weeks. I wanted to retire, but I can't because having led the Philippine Foundation for Vaccination since its inception in 2000, I wanted to retire. I was so happy. But the events of these last 2 years has really stimulated us to really come out and, speak up, because the international scene is now looking at the Philippines as the #1 vaccine hesitant country in the world. And maybe Dr. Eric Tayag will address that. And I have been invited in some seminars to really ask me what's happening in the Philippines and maybe what can be done, because we are also influencing other countries in our quest for, in struggle for this vaccine hesitancy. Kawawa ang Pilipinas. And now with all the polio and the measles, naku, hindi na tayo makakaalis sa ating country unless you are vaccinated and you can be showing your certificate that you have been vaccinated. So, without further ado, I'd like each one of you to maybe give an opening statement on this topic of vaccine hesitancy. What is the current analysis that you have, and maybe talk a little about what each of your position could do for our country and our people. We'll start off with the Philippine Foundation for Vaccination, Dr. Shelley.
Thank you very much. We at the Philippine Foundation for Vaccination have been doing great work, hard work, for the past 20 years in communicating what vaccines are needed for our children, adults, and senior citizens. Our main mission really is to reduce human morbidity and mortality through excellent communication, vaccination courses, vaccinology courses, national immunization conference such as what is happening now. And we also have moved on to not just training but also research on vaccines. And hopefully we will have more service for those who need vaccination. So we want to have ethically and scientifically accurate communication on the benefits of vaccination for our Filipinos. And the role of the Philippine Foundation for Vaccination for the past 12 years hopefully will be more relevant now that we have this vaccine hesitancy going on around, not just the Philippines but the world.
Hello, I'm Dr. Maxino. I'm also representing our congresswoman, but since we share the same thing, let me just read to you the message of our congresswoman. I mentioned it already in our forum earlier, but for the press, so that I need to say it as quote unquote because mahirap na sabi that is different from what she said. So she said that she sincerely regret that she cannot make it today. She's in Congress, but she thanks everyone for choosing Batangas as the host province. This year's conference theme, addressing vaccine hesitancy and increasing vaccine confidence, is quite appropriate with the current time. As you know, since she was a mayor of Lipa and then governor, health has always been her advocacy and her top priority for her constituents. The past years, she mentioned, we as a nation have dealt with quite an issue related to immunization, particularly the Dengue vaccine issue. we have to admit that this issue created a negative impact on the public's perception of vaccine safety, thus creating a vaccine hesitancy. So most Filipinos have lost confidence in the importance, effectiveness, and safety of vaccination. Although other vaccines have been proven safe and success rates have been established, the efficacy has been tainted by the issue. So it is with this concern that programs such as this national conference plays an important role in addressing and eliminating misconception and skepticism towards vaccination. So both government, non-government, healthcare agencies, private hospitals are on the same goal of uplifting and improving our fellow men's health and welfare. So she believes vaccination is one of the many ways we can do it. It is only through education that we can address the issue of vaccine hesitation and regain the public's trust and confidence on immunization programs. So she said that we should really work collaboratively in massive education campaign which should highlight the positive roles and benefits of vaccination and immunization programs. We should not disregard the fact that other vaccines have been proven effective and safe in reducing mortality and morbidity of virus infectious disease. So she said that she believes the importance of vaccination, and she also believes that it is our moral duty and obligation to help ensure the health and wellness of our future generations. We owe it to them to discover new and effective and safer vaccines. More so, we owe it to every Filipino to provide appropriate and inclusive healthcare programs such as immunization, especially now that times are changing and health threats are more challenging. So she welcomes everyone here in Batangas to this national conference. Thank you.
Isang maningning na umaga po sa inyo lahat. It's really bright here, no, with all the cameras. Well, I would like to, in Philippine Medical Association, we have a clear vision in PMA that to promote healing ministrations in the delivery of healthcare system in the country. We have this mission in humane service and of course selfless dedication of the entire medical profession for a healthy Philippines, of course for the glory of God. With this, we had this platform in the PMA, build PMA. It's somewhat different from the build of President Rodrigo Roa Duterte. 1 hour is once built, we build the trust and confidence of all members of the medical profession to achieve a more vibrant PMA. Second will be to build bridges, not walls, to all these government institutions, non-government institutions, even Rotary. And of course, to really strengthen the trust and confidence of the public in the medical profession. That you know, somewhat probably tainted because of this the vaccine controversy. But you know, we physicians are here, and we are true to our sworn oath that we are here to serve the Filipino people. And of course, I would like to really emphasize this. I'd like to reiterate, since we have our DOS, Dr. Eric Tayan, that we are in full support of all the endeavors of the Department of Health, and of course, as well as to the Philippine Foundation for Vaccination. Another they build infrastructure for efficient delivery of services to all members of PNIC. I think we have that in mind. We develop strategies like that's what everybody's doing, no? In order to develop strategies, policies, guidelines, you have to start thinking about trust. That's why the trust now of the team now addressing vaccine hesitancy, and of course addressing also increasing the confidence and trust in the vaccine. And of course, we have to really rebuild the trust and confidence in, of course, in the immunization being espoused by everybody now. I hope we could really say that vaccination, no? We have to vaccinate everybody. And I'm really, sad that hearing from Dr. Bravo that we are being labeled international, no? And I've been to a CMAO conference in Goa, India, with Dr. Chensa, and of course discuss also the vaccine hesitancy, and the recent one last 2 weeks ago in the World Medical Association. All countries are really talking about this vaccine hesitancy because we're not the only country also affected. It's been worldwide also, global problem also. But with that, I think we're still in the right direction. We are now in one group, one family, one voice to really speak about this vaccination, the importance of vaccination, so that we could really reach to our kababayan, especially in the countryside, especially also the Jida area, so that we could really see that we are really working together, collaborating. We're not competing with one another. We are collaborating to maximize our resources, our health resources, for more people who can be served by our collaboration. Thank you.
Dr. Eric?
Good morning, everyone. It is 44 days before Christmas. Everyone is looking for a special gift. Why not make that vaccination? So mothers, I know you're making a list, checking it twice. You want to find out who's naughty or nice. Naughty or nice, these children should be vaccinated. And the Department of Health is appealing to all mothers, and its Secretary Francisco Duque III is here. The best Christmas gift is for your child to be fully protected. So we have more rounds in selected regions by next week or before November ends. There's going to be a second round of polio vaccination for children, and we hope that we sustain the high coverage, and the DOH wants to thank those who have supported these extra vaccination campaigns. Now, there are two secret formula for the success. One, together we can. DOH cannot do this alone. We have to do this with PMA, with the Philippine Foundation for Vaccination, with the media, and of course the second one, for any problems or issues, whether it's controversial, it's politics, or it's financial, everything is figure outable. So if you're looking for a gift this Christmas, the gift that's going to protect your child is vaccination. Do it now, do it always. Thank you and good afternoon.
Good morning. I'm also a pediatrician like Dr. Adu Bravo. I will share to you the sentiments of the medical society, the Philippine Medical Association, in the whole medical community, including the World Medical Association, as I said, Dr. Santiago, the CIMA. We are founding member of the Confederation of Medical Association of Asia and Oceania. We're saddened by the news that DOH confirmed that polio is reverting in the Philippines after the country was declared polio-free in 2000. Today, diseases do not recognize borders. Globalization has eased travel. It had also become more frequent. It facilitates rapid spread of infectious diseases with the country and around the globe. Confederation of Medical Association of Asia and Oceania wherein the Philippines is a founding member, issued a resolution last September 5, as Dr. Santiago, we attended the conference last September 5. Given the potential for the hesitancy to undermine vaccination coverage in specific setting, it is important that all countries take steps to understand both the extent and nature of hesitancy at the local level. On counting basis, accordingly, it's not member countries should develop a strategy to increase acceptance and demand for vaccination, which include ongoing community engagement and trusting building and active hesitancy prevention, regular national assessment of concern and crisis response planning. PMA reiterates the full support to DOH and the country primary stewards of the guardians of our people's health, but it alone cannot fully achieve the enormous task of confronting the various challenges in the private sector. PMA advocacy kaalaman tungkol sa bakuna was tackled an important vaccination emphasis on polio in our community involving the 190 component societies of the PMA all over the country during the Medicine Week. This is the best time of the year to reach out our community. PMA Health Literacy Advocacy Program is centered on the communities and families, including grade school and high school students. PMA joined the DOH campaign against polio through strengthened synchronized polio vaccination campaign or Sabayang Patak kontra Polio in order to disseminate timely and accurate information to specific target groups and encourage parents and caregivers to have their children immunized with polio. The Philippine Medical Association is making all its effort and collaboration with vaccine experts and medical associations like the PITSP, PISMID, and Philippine Foundation for Vaccination to come up with different strategies to combat vaccine hesitancy. Today, we are having the 20th Philippine National Immunization Conference with the theme Addressing Vaccine Hesitancy and Increasing Vaccine Confidence. This conference was attended by national lawmakers, health and vaccine advocates, teachers, barangay health workers, government and non-government health workers. We reinforce and reiterate these unity statements made by PMA 2 years ago. PMA will continue its wavering support to WHO, DOH, and other stakeholders to rebuild its public trust in our health institution battered by crisis immunization program. We pledge to our people the strengthening the collaborative efforts between the private and the public sectors by improving the referral system and aim to achieve the seamless healthcare delivery network. The lesson learned from our experience should provide better opportunity for all of us to translate into action all government, all society, all system approach in providing health for all our people. Lastly, we appeal to you, all media people in print, radio, TV, and social media to consider and listen only to our vaccine experts and spread the true scenario of the vaccination status in the Philippines. Maraming po salamat.
Thank you very much to our distinguished speakers. Before we open the forum and be ready with your questions, please identify yourselves and the paper or newspaper that you are representing. You have heard our 5 speakers talk about how they are trying to address vaccine hesitancy. You know, the Philippines, way back in the 90s, was a leader in vaccination. We were the first to do national immunization days, copied by Latin America, initiated by then Secretary of Health, Juan Flavier, who became the top-notch senator, except for the fact that they used his vaccination of pregnant women as his kind of opposing view and made him number 4 instead of number 1. But he was so popular. And we led in terms of using the first country to use combination vaccine. You don't have to give 5 vaccines. Only 1 vaccine will do because we were the first country in this part of the world to use combination. We were the first to use rotavirus in this part of the world in 2012. We were the first to use, at least not Pakistan, but we were the first to use PCV in the national immunization program. But now we are also the first country in this Pacific region to become the #1 vaccine. What did you call that earlier, Eric? No longer vaccine hesitancy, but
It can easily turn into vaccine hatred.
yeah, that is really so dismaying. But right now, that is how we feel, and some other people
But-
feel about us.
But things are going
Moving up.
rosy. Yeah, because of the results of the polio additional vaccination campaigns we just completed. It's over 90% in many
Let's
areas.
give that a big hand of
That's
applause.
a,
The Department of
that's
Health
a very good sign.
has actually
We are back in
increased.
business. Immunization is back in business.
Okay, and if things, go really start looking up with the help of other stakeholders, like Dr. Benito Atienza said, we do need, and also Dr. Santiago also mentioned that we do need the support of everyone. This is a stakeholders meeting, I hope, that will really empower everyone to do something for our vaccination programs. Because as you know, how many died for measles? We did not have measles death nor measles case in 2005. Dr. Eric, can you expound on that? How measles became the #1 fear last January when we had so many deaths?
The thing with measles is there's what we call accumulation of susceptibles. This is how I'm gonna explain it. Let's say for example, the vaccine efficacy of measles is 90%. 90% could be protected after getting the vaccine. Tapos halimbawa yung vaccine coverage, 90% of the eligible population ay mababakunahan. 90 times 90 is only 81%. So 19% doon unprotected. So halimbawa, may 1,000 tayong bata. Alam mo nga, gawin na natin 100,000 bata. What's 19% ng 100,000? 19,000. Gawin mong taon-taon yun. Okay, mag-accumulate. At kung 5 taon yun, 95,000 in 5 years unprotected. So, that easily explains kung bakit nagkaroon ng measles outbreak. So, tumaas yung kaso natin ng measles kasi nga, nag-accumulate yung susceptible. Maraming batang hindi nababakunahan. Every time na bumababa yung vaccine coverage, that's danger for us. Kasi the children are the one who get sick and susceptible adults katulad natin, if we're not protected, will also get sick. Diba? That's why maintindihan nyo, hindi kailangan bakunahan lahat. Yung mga bata who are most vulnerable ang dapat bakunahan. So pag nabakunahan sila, we're also protected. So dapat malinaw yun. So the DOH has slowly but surely gained the trust ng mga kababayan natin, and we hope that we can maintain the trust at sana ay hindi na bababa yung vaccine coverage. So yung vaccine hatred, that's out of the picture. Vaccine hesitancy, medyo over the bakod na rin yan. So ngayon we are siguro parang renaissance to, Dr. Bravo, that people are lining up. Alam mo, ako mismo kasama sa pagbabakuna. Talagang nag-aagawan pa nga sa pila, gusto nilang mauna. That's a good sign. Rather than months ago, halos ibigay mo na yung bakuna, ayaw nila. Ngayon it's different. At least from what I've seen.
Yeah, it seems that people will not believe vaccines save lives, but when they see vaccine preventable diseases getting all those deaths, that was when they started to run to the health centers to get vaccinated, because measles, every day there were 10 to 20 children dying from measles, whereas in 2005, 0 measles, 0 deaths. We were almost eliminating measles at that time, right?
We lost that advantage kasi yung measles, muntik na natin ma-eliminate. Somehow, something happened, bumaba yung vaccine coverage, At maraming dahilan nito. Sometimes maybe the vaccine was not available at the health center. Sometimes maybe the parents did not understand that a mild infection or a mild disease is not a contraindication para bakunahan. So, kahit ngayon, Dr. Bravo, nung nagbabakuna kami sa polio, there's also a misunderstanding na bakit pa babakunahan kung nabigyan na ng polio. We want to make sure that everyone is protected. This is not only for protecting an individual child, but this is protecting the population. Yun po ang kaibahan kung bakit kahit na nabakunahan ay kailangan bakunahan ulit at wala hong overdose yan. Ito po ay may sapat na katibayan at yan naman ay natangkap na paliwanag ng pinaliliwanag namin bahay-bahay. So maganda naman ang reception ng mga tao. Kaya lang, may mga lugar na mababa pa rin yung vaccine coverage kasi may mga maraming dahilan na may mga yung migration, mabilis na migrants, migration natin, in and out sa malalaking urban areas, pag hindi nalaman ng local government unit na ang dami palang migration doon, maraming mga batang mamimiss kasi wala sa listahan yun. Kasi biglang mga bagong salta. So walang vaccination record. Na-miss yung bakuna doon sa pinanggalingan nila. Kaya dahilan nyo kung bakit may mga batang hindi pa nabakunahan. At yun ang pagmumulan ng outbreak.
Yeah, please take note. Dr. Dayan mentioned vaccination is not only for individual protection, it is actually a public health priority that everybody should really try. If you love your kids, you should also love the country, right?
At saka Lulu, siguro sa sangayunan ako ng mga kasamahan natin dito. Minomonitor din kasi ng Department of Health yung social media. There was a time na medyo nananalo yung mga anti-vaccines.
Trolls,
Ngayon medyo
vaccine bulliers.
mukhang merong upper hand na yung mga vaccine champions. Sana magpatuloy yun. And so, therefore, the lesson we learn is that if we are consistent in providing the right information, fake news will just die.
Okay, talking about fake news. Any one of you who would like to?
May I just
Address
add
us? Yes,
something?
please.
Just want to mention that we're not only talking about immunization for pediatric population, but also for adult population. It's good to know for also the media that like adults, we have pneumonia vaccines and influenza vaccines, and I think we should know when to give this. What's the right time? We don't give pneumonia vaccine every year. We give it like every 10 years, and then 5 years, or it depends. And then the influenza vaccine also can be given yearly.
Just to add on to what Dr. Maxino just said, no? Ako po ay isang geriatrician, so ang aking mga pasyente ay kung senior citizen. Alam natin na may batas, yung RA 9994, sinasabi na yung mga indigent natin, ng mga senior citizen ay dapat napapakunahan laban sa laban sa trangkaso at pulmonya. Pero kahit hindi po sila indigent, ay sana mapakunahan din sapagkat konti na lang ang panlaban nila sa infeksyon pagka tumatanda na, at ang pagpapakuna ay isa sa mga pinaka-epektibo na panlaban ng mga ating mga senior citizens. Sa mga mas nakababata naman, lalo na yung mga nagtatrabaho, mga health workers, no? Yung mga nakatira sa mga institutions, at ang mga buntis po ay dapat din nababakunahan lalo na sa kanilang third trimester ng pagbubuntis, bakunahan laban sa influenza sapagkat delikado po sila rin magkaroon ng flu sa kanilang pagbubuntis. So sana mabawasan yung mga na-hospital at namamatay dahil sa trangkaso lamang na preventable naman at sa pulmonya. Pagka po nabakunahan kasi may panlaban sila kahit paano.
So now we are approaching immunization for all ages, mind you. Take note, it's no longer just the children who need to be vaccinated. You're not too old to be shot. Every sector of society need to understand. And maybe, Doctor, before we really open the floor, Dr. Santiago, can you give us a possible strategy for all our health practitioners, being the leader now of the Philippine Medical Association? Can you do something so all the doctors will really, my feeling is not all doctors, or not all, many doctors do not know. They're sometimes so ignorant of what vaccination is really, what really it is. You can ask your doctors if they know about flu or for pneumococcal. So can you do something as head of the PNA?
Thank you, Dr. Bravo. I think right now we have 84,000 doctors in the country. And of course, we really doing our best to really help DOH and other government agencies to really promote this vaccination. We have this 17 regional assemblies that we do every year in PNA to really remind our doctors of the importance of vaccines. And sometimes you really set aside this importance of this vaccination. Parang nagiging teka muna. So that's what really happened after the controversy. Teka. So wala naman ng teka. It's right now. We have to really start again. So I think it's a fresh reminder to all our doctors. And I think doctors now are really trying to also communicate, especially with the media, to help disseminate the right information. And it's really important that we collaborate with the media. And something that we have also, that we need some help from the Philippine Foundation for Vaccination, DOH, in elevating or increasing the health literacy also of our community. And that's really very important for us. They said that you cannot give something you do not have. Something also with the media. You cannot, give information that you do not have. Probably the purpose of this press conference to really give you some information so that we could really, cascade this to your listeners, to radio, to TV, so that we could really see how really go to the level of our kaubayan. I'm sure there are a lot of radio listeners, TV, that we can reach out to our kaubayan. And of course, we are parallel with this kind of direction. And again, I'm appealing to the media to really help us to really spread this information. Dissemination. And as Dr. Tai said, we cannot do it alone. We need new media to also to really propagate this information.
Dr. Bravo, may add lang po isa pa. Yun sa vaccination for pediatrics and adult, yung sa hepatitis B vaccine is very, very important. Dahil may mga cases na kami nakita na pregnant women, hindi nila alam na sila ay hepatitis B positive. Very, very important na ang bata ay mabigyan na agad ng bakuna ng immunoglobulin plus vaccine pagkalabas ng bata. Kaya importante dahil kung iintayin mo pa ang after 24 hours o 1 week, nagkakaroon din itong mga bata ng hepatitis B, and delikado para sa mga bata na magkaroon din sila because they can develop hepatocellular carcinoma at an early age. We've seen that in our practice na Dr. Roy Gonzalez, na we're gastroenterologists also. So, meron 31 years old, hepatitis B positive, pero may cancer na. So, meron din kapatid na meron. So, we had to get the mother to have her tested, positive ang mother. So, true enough, kailangan malaman din talaga na so preventable yun, at saka pagtanda din, siyempre kung wala ka ng antibody at bigyan ka ng vaccine ng bata ka pa, then yun, sa information dissemination, they have to have a booster dose given when they're already adults so that they know. So maraming other things that we have to consider, not only for, again, pediatrics, but also for adults.
As a pediatrician, we must involve, ang isang project ko is health literacy for all Filipinos, meaning sino yung mga Pilipino, dapat umpisahan natin, ang ano natin ay yung mga doktor, kasi yung mga doktor dapat mismo ang magpabakuna para makita ng mga pasyente na safe yung bakuna. Like Dr. Lulu Bravo, siya ay nagbakuna sa akin ng pneumococcal. Kasi libre, pero kahit
Nasa social media yan.
kasi dapat pakita ng mga doktor na sila mismo ay naniniwala sa bakuna. Kasi mahirap ka mag-advocate ng isang bagay na hindi nakikita lalo ng media. Then, ano pang kailangan natin? We must involve all doctors, at hindi lang mga pediatrician, OB, IM. Lahat ng doktor dapat ay advocacy ang mga pagbabakuna sa clinic. Pwede tayo maglagay ng mga sa waiting area natin tungkol sa bakuna. Then, isa pang strategy natin, sana may law na all, bago natin admitin sa isang eskwelahan, ang 4 years old, dapat may ang problema natin yung immunization record ng mga bata. Kasi nawawala, hindi natin alam. Kasi eskwelahan, hindi nila alam, wala silang, like in our school system today, buti na lang isang bata makita ng isang doktor sa 6 na taon. Kasi isang doktor sa school physician, ilang distrito ang kanyang titingnan. Kaya we must involve all doctors in the Philippines to adopt at a school. Then we will include this vaccination. Dapat may record bago pumasok na eskwelahan. Kasi, di ba sabi natin, teach a child the way he is or he is, and he will not depart from it. Ibig sabihin, turuan natin yung mga bata. Sila yung mga bata na magiging adolescents, adult, and later on sila yung magulang. Kasi pag bata tinuruan natin, maniniwala yung magulang. We have a project, this is the Child Willing Health Workers Foundation. We teach young students from grade 4 to grade 6. Alam ba ninyo ngayon sila? Sila ay mga doktor na, mga pathologists na sila. After 23 years namin, sabi ng isang sa foundation, sa SEC, paano kayo nakapagturo ng mga bata? Paano yung nakapagpatapos kayo ng doktor, nakapagpatapos kayo ng nurse, mga health workers, kung walang pera ang foundation? Sabi ko, ang foundation hindi importante ang pera, importante yung dedication. Ibinigay namin yung time na turuan sila. Pero ngayon, mga doktor na sila mga nurses na tumutulong sa amin. Siguro ganito rin gawin natin sa vaccination. Bata pa lang turuan na natin. Dapat may record sila. One time in my clinic, may isang humihingi ng certification for vaccination kasi mag-a-abroad siya. Doc, pwede bang ilagay niyo yung mga vaccines niyo? Kasi ako, 25 years na po ako nagpa-practice, hindi ko po dinidiscard ang aking mga records. Why? Kasi yung importante sa aking vaccine. Kasi later on, hihingi sila ng record. Pag pinisan ko sila ng record, wala po kayong nakabakuna sa akin, baka po doon sa health center. Nawawala po yung record sa health center. Pwede pa po kaming bigyan nyo ng certification, ilagay nyo yung mga vaccine na bigyan. Hindi po, ini-explain ko. Kaya po yung ginawa, para ka mag-a-upload kayo. Kaya mas safe magpabakuna po kayo. Meron pong catch-up vaccines sa mga adult at saka sa mga bata. Yun po importante. Kaya sinasabi ko po sa mga pasyente ko, tuwa-tuwa sila pag nag-abroad yung mga patient ko. Why? Kasi kumpleto po yung bakuna nila. Kasi ini-emphasize ko po yun. Kasi saan sila pumunta, kumpleto. Tuwa-tuwa sila. Doktor, ang ganda-ganda ng vaccination record ng anak ko. Kahit saan pumunta po kami, kumpleto. Diba? Babalik at babalik po yan.
Okay, so we now open the floor. Yeah, a short remark from Dr. Santiago.
Kasi Dr. Bravo, hindi sila nagtatanong eh. Pwede ba ako magtanong sa kanila?
Hindi pa natin na-open yung floor eh. We have not opened the floor. But if you have one short, because we really need to open the floor now. This is everybody. So you have a message? Yeah, actually now we're open. Please state your name and the newspaper or magazine or something. Yes, please. I can go here. Here.
Ramos, I'm from CNN Philippines, Batangas.
CNN.
Recently, we have already the fourth victim of the polio. I think fourth
In Batangas or in the Philippines?
in the Philippines.
The Philippines.
And my question is, why is that kind of type of polio coming back again? And do you think we need to update the kind of vaccine that we are giving right now?
Do we need to give polio again? I think I will ask Dr. Tayo for that.
Number one, when we report these cases, that's a strong indication that our surveillance system is working. Kasi one of the parameters that will give us enough confidence to say that we are still polio free is we are able to detect, identify these cases. So, when we report these cases, ibig sabihin, yung surveillance system natin is working. But having said that, yung tanong mo, why is this happening? This is expected, that's why we are watching out for this. Expected because we are using the oral polio vaccine. And there are two types ng polio virus strain that can give us paralysis. Yung wild polio virus, which we don't have, that's why polio-free status pa rin ang Pilipinas. And yung vaccine-derived polio virus, which appears when there is low vaccine coverage sa isang community. Pag mababa, yung vaccine na yon na nasa bakuna, nag-mutate yun sa bituka natin, we shed it off, another child gets it, mag-mutate ulit sa intestine, sheds it off, it takes several months, isang taon yun, okay, matitsyempo ngayon sa batang walang proteksyon sa bakuna, ergo, magkakaroon ng paralysis, parang na-infection ng wild polio virus. Kaya, para ka magkaroon ng paralytic polio, dalawa ng pagkagalingan. Yung wild polio virus na wala tayo nire-report, at saka yung vaccine-derived polio na lumalabas doon sa mga lugar na mababa ang vaccine coverage.
Yes, we would like to welcome the governor.
Hello,
of Batangas,
It's our pleasure of this
the
joint
Honorable Governor Hermilando Mandanes, the governor of Batangas.
Gov, join us here.
Beside, yes, so we are very, it's our pleasure and our honor to have the governor of Batangas with us. Governor, we are now in the midst of talking about vaccine hesitancy, and perhaps you can tell us before we, give him some opening statement on what you think is Batangas, your province, going for vaccine hesitancy. What's your general feel about the people in your community, in your province? Are they going for more vaccine hesitancy, or you think you can already address that and you can be also a champion for vaccine?
Well, number one, I would really say number one issue that we have in Batangas is really to upgrade our health care, and definitely vaccination is an essential element in really having a leveled up state of health care. And well, this is not only what I think. We are putting it into effect. Right now, we have budgeted no less than 2 billion in our health program for this year alone. For this coming year, 2020, we borrowed 4 billion from DBP, in addition to our regular budget of over 4 billion, and really 2 billion of that would be health related. And that's why we're very happy here in the province of Batangas that in addition to the program, that we are really intensifying the really not only awareness, but really being able to effectively execute the vaccine program. which we know is very, very important with all the, you would say, recurrence of certain diseases that really now we are very open. We have been very open even before. That's why with the Denvaxia issue before, Batangas was one of those highest in terms of people who were vaccinated with Denvaxia and dengue vaccine. And but I also have to mention my observation that, well, with the experience of Denvaxia and what happened, well, you could expect, as could be expected, that there are hesitancies or reasons to be hesitant here in the province of Batangas. But now that with the new developments regarding this particular issue, I think I'm very happy that we are participating in making people aware of the real situation. And all the time, I mean, having real situation, then that would really help, like what we're doing right now, in giving them the real issues, the truth, and where media, of course, would be the main cooperators in spreading the truth about vaccine. Therefore, this is something that we really appreciate, and we have to thank our national government, specifically our Department of Health, and probably even specifically Dr. Tayan, who has been the face of this particular program, in really pursuing it. That's why I thought it was very important to come over here and mention these things to you. And again, as I said, to also express our appreciation. And you could see that our medical association and our top healthcare givers like Dr. Bobby and all our members of our association really are focused on this particular issue. But as I said, I wouldn't want to limit it only. This is very important, and definitely we're pushing it. But that is only part of a program that we really have to push with the implementation of the universal health care. This is a very integral part. But just to let you know that we are aware that with the implementation of universal health care, more things have to be done. So, Doctor, I'd like to take this opportunity really when we give really quality health care, it has to be supported with more doctors, more nurses, more equipment, which we're doing here using our own funds. And even we're now thinking advancing the reimbursable amount that it would be the province of Batangas that would be waiting for PhilHealth to give reimbursement. But for the meantime, the doctors and the health practitioners, after they have performed the procedures, then the province would advance already, and we will be the ones to wait. Because that way we thought that we will be able to attract good doctors, in addition to what we're trying to do for the province to buy on our own equipment, and not only diagnostic but all aspects, not only reimbursable but even not reimbursable but by PhilHealth. That's to show our concern. And as I said, having this vaccination program is very much part of our concern.
Thank you very much, Honorable Governor Mandaras. Take note, ladies and gentlemen, he has said that in Batangas, vaccine hesitancy is being addressed and the tide has turned. the Dengvaxia issue is slowly, hopefully getting away, and you are now addressing. It was last year in Bataan with Honorable Secretary of Health Duque and our Governor of Bataan. That was at the press conference, and it was the first time that Dr. Duque announced that Dengvaxia, in the Dengvaxia issue, there is no evidence at all that it did harm these kids. And mind you, that was the time that the PAO office started to raise their voice again. And hopefully, this will all be down the drain in the future, and with the good governors and all the people working together, just like what Dr. Santiago said, we need all your support, even media, because we really need to have those issues addressed. Dr. Duque has time and again, since last year, I was happy. I was also the moderator of the press conference when he did mention for the very first time that there is now proof, no evidence at all, that Dengvaxia has harmed those kids. And I hope you keep repeating that, because this has been one of the worst issues we have had to deal with when Dr. Honorable Batangas governor said, in fact, that they are doing their best to make sure that there are funds available. But you know, it is so expensive to have curative and rehabilitative care, even for universal health care. And immunization is at the core of universal health care. Without the proper promotive and preventive aspects, it will fail if we do not have the right attitude towards prevention. Because it's so expensive, isn't it? How much do you spend for curing cervical cancer versus vaccines? Okay, so
May I just
yes, sure.
something? Really, part of our effort, well, not only part, but really the main foundation of our effort really to push the Dengvaxia and vaccination in general issue is because of our trust and confidence. I mean, as politicians, as a governor, the same thing I'm sure with the other governors mentioned was my colleague Abed of Bataan. I have to mention that we are endorsing this as governors because we trust the Department of Health. Huh? I mean, when you say no damage has been done, we endorse because you made that pronouncement and we trust you. It is not because we know that there has been no damage. I just want to and the same, because health is such an important issue, and they really are, health is really in the hands of our good doctors. Huh? So we are doing it because we trust you. I mean, that's the real situation. Not because we know that it has done no damage. I mean, because, for example, we don't know whether some vaccines, as contended by others, and here the DOH has not yet made any pronouncement, whether they have side effects. Like some would say that some vaccines really were being really promoted. Number one, of course, because it's going to be good for the health, preventive, but also it prevents or lessens fertility of mothers, of women. So we don't know whether there are side effects or not. That, as I said, part of it would be our trust and confidence with the Department of Health.
What the governor is saying is that politicians are really now, the good governors are now using science as the evidences for your
We trust you, in other
policies.
words. That's really that what you're saying is true. That's
Yeah,
what-
the evidences are based on science and not on fake news or lies. So please, any other questions? Again, please introduce yourself and your
Good morning, ma'am. I'm John Antrayas, Publisher of Bahayag ang Balikas. My question is for Dr. Tayag because binalik nyo itong kampanya para sa vaccination. Gaano po bumaba, hanggang saan bumaba yung kumpiyansa ng ating mga kababayan na magpabakuna? Diba, sabi nga, nalagay tayo bilang #1 country na hesitant magpabakuna. Hanggang saan bumaba yung level ng pagbaba ng kumpiyansa ng tao na ayaw magpabakuna? Salamat.
Okay. We do not have a survey that will corroborate your statement na gaano kababa yung kumpiyansa. But we have an indicator yung vaccine coverage. Okay, vaccine coverage na kung saan bumaba talaga siya over the years and maraming dahilan. So hindi lang kumpiyansa yan, may mga dahilan na may kinalaman sa health system, pinaliwanag nga ni Gov. Halimbawa, pwedeng bumaba yung kasi naubusan ng bakuna sa isang health center. Pwedeng bumaba yun kasi nagdalawang isip yung nanay para dalhin yung bata dahil hindi niya alam na kung simpleng ugot sipon lang, hindi naman pala bawal magpabakuna. Pwede pa rin bigyan ng bakuna. Bumaba yung vaccine coverage kasi hindi nasusunod yung schedule. Kaya pag pumunta yung bata, hindi naintindihan ng magbabakuna, hindi binabakuna. Nangihinayang halimbawa na isa lang yung pumuntang bata, yung bakunang available para sa maraming bata, ayaw niyang buksan, baka manghinayang siya. So pauwi yung bata, hindi na pabakunahan. Sayang yun. Ang tawag doon na missed opportunity. So, yung kumpiyansang sinasabi natin ay nang minomonitor namin kasi yung mga social media at lumalabas sa mga unofficial na panayam namin ay binibigyan nilang dahilan yung nangyari pa rin sa Dengvaksha. Subalit wala kaming formal na survey na may share sa inyo na nagsasabi na yun ang dahilan. Yun ay ang lumalabas, yun ang nasa isip, nasa pakiramdam ng marami. Subalit, dahilan sa nakita namin na tumataas na ulit yung vaccine coverage, na sinubukan namin gumawa ng mga paraan para tumaas yung vaccine coverage, lumalabas na maraming mga impluensya ang nagbibigay sa amin ng resulta kung bakit mababa yung pagbabakuna. Hindi lamang yun sa vaccine.
Okay, can we ask the lady who has been
Good afternoon ako, Dr. Shelly po. Doktora, may I ask kung ilan po bang kind ng bakuna meron tayo dito sa Pilipinas? Pangalawa pong tanong, ano po ba yung pinaka-importanteng bakuna na meron dapat ang isang tao? At pangatlo po, magkano po ba yung mga bakuna na yun? Kasi hindi lang po sa issue ng Dengvaksha ito. Issue po ito ng presyo. Issue po ito ng kakayahan ng isang tao na magpabakuna pagdating sa kanilang bulsa. Yun po. Ako nga po pala si Jay De Castro po from Brigada News FM 104.7. Thank you po.
Salamat, Jamie.
Jamie po.
Jamie.
Thank you.
Ako ay specialista sa senior citizen, geriatrician ako. Kaya Jamie, ang nasasabi ko sa iyo para sa ating mga senior citizen, ang pinaka-importanting bakuna sa kanila ay influenza. Na taon-taon yan binibigay sapagkat influenza virus changes every year, napakatalino niya. Ang pangalawa ay ang pneumonia vaccine, no? Pneumococcal vaccine. Dalawang klase yan, yung 23-valent, yung isa yung conjugate 13. Mas mahirap mahanap at mas mahal ang conjugate 13, umaabot ng 2,000 ang isa. Kaya ang nabibigay natin kadalasan na matagal na natin ginagamit ay ang Pneumo 23 na kuminsan ay 500 to 800. At kung ikaw ay 65 years old na, at nabakunahan ka ng pneumonia 23 or conjugate 13, hindi na yan inuulit ng every 5 years. No? Hindi na yan every 5 or every 10. Kung ikaw ay bata pa sa 65, yan, dapat every 5 years ulitin mo. Pero, gaya ng sabi ko, hindi na yan kailangan pag 65 and above. Ngayon yung ibang mga bakuna, si Dr. Bravo, alam niya kung gaano marami yan. Kung ilan, kasi ang mga bata, talo talaga ang mga. Pero importante mabigay at least flu and pneumonia vaccine. Meron ding mga bakuna para sa mga senior citizens na tinitignan namin na dapat magkaroon ng tetanus, no? Tetanus vaccine kasi lalo na pag may diabetes. Pag nababalian o nagkakasugat sa paa, importante rin yan. Yung herpes zoster, yung parang, ano ba yun? Yung herpes zoster ay galis, parang galis yun, pero galing yan sa chicken pox ng kabataan. Kapag humina na ang resistensya nila, pagka tumanda na lumalabas ito, no? Na tinatawag natin na herpes zoster. Siguro si Dr. Bravo ang makakasagot ng gano'ng karami pa ba ang ibang bakuna?
I'm the moderator. I'm not
Hindi daw pwede. Siguro Dr. Taya.
Dr. Tayag. Ay, itanong ko na rin
Sa
po, Doc,
bata,
ano-
hindi bababa sa 100%.
Isang dosena. Ano po yung mga libre naman?
Libre naman. Sa Department of Health, libre. Oo, so pagkapanganak pa lang, meron ka ng BCG, tapos meron kang hepatitis B. Starting at 6 weeks, binibigay yung oral polio vaccine, 3 shots yun. Every 4 weeks yun. Tapos kasama rin yung DPT, so 3 na kagad yun. Diphtheria, pertussis, whooping cough yun, at saka sa tetanus. Tapos meron kaming 5-in-1. Okay? Para na sa ganun na pagbisita, isa na rin yung ibigay. Kasama na rin dito yung DPT, yung HIB, Haemophilus influenzae B. Tapos at 9 months, measles vaccine. Inuulit yun at 12 to 18 months kasi pag binigay may measles vaccine less than 12 months, may mga bata hindi pa protektado kaya inuulit, kaya 2 doses. Ngayon, ang gusto namin sa mga age na bracket na binanggit ko at saka pagpasok sa eskwela, meron din kami sa mga adolescent para sa cervical cancer, yung mga papilloma virus. Libre yun, oo. Pero sa inyo, bibili kayo. Para sa mga bata, libre. Oo, kasi binibigay namin yan at 9 years, 11 years. Although may recommendation ngayon, kahit anong edad sa mga kababaihan, kasi mataas din yung cervical cancer sa atin pwede ibigay. Sa ibang bansa nga, yung mga kabataan lalaki binibigay.
For those of you who have internet, please log on to the philvaccine.org. You will see the latest childhood immunization schedule for 2019, the teenage, and even the adults.
Yes, yan po ang trabaho ng Philippine Foundation for Vaccination is to print yearly immunization schedule. Updated
Yes.
and update.
Ang pinakabagong in-introduce ng DOH yung sa Japanese encephalitis.
Yes, and it's already
Yeah.
there in the 2019.
Kaya lang sa mga piling lugar lang yun, sa mga lugar na kung saan nakukuha nito sa kagatan lang mo. Ayan, katulad niyan. No?
And by the way, it also includes those that are available in the national immunization, in the DOH. So if there is a mark there indicating which ones are available from the DOH, and that means it's free. If it is not yet in the national immunization program, it has to be taken from the private practitioner, right?
Ganito po yun. Ang Department of Health ay merong listahan ng bakuna na dapat ibigay ng libre sa mga bata. Ang mga bagong bakunang i-introduce ay kailangan i-recommend ng isang komite. So hindi yung desisyon ng Secretary of Health sapagkat kailangan may approval yan ng FDA. Kaya nga sinasabi ni Command Danas, pag sinabi ng DOH, bibigay yan, may trust and confidence kasi yun, dumaan sa FDA, dumaan sa WHO, maraming pinagdadaanan yun. Alam nyo ba, bago namin ma-deliver yung bakuna, ang daming checkpoints. Dapat may approval ng FDA, dapat ng WHO, siya pre-qualified. Dapat yung pagdadala ng bakuna may nakahandang mga refrigerator. Dapat yung mga health center na yun may marunong magpakuna. Merong mga immunization card. So, dapat kompleto sa Ricardo yun. Libre yun. Libre. Ang malungkot, yung ibang magulang, kasi parang meron tayong sa ditong kaisipan, pag libre, parang hindi binabaliwala natin. Kasi libre Diba? Pag libre Kung pag kumain ka, masarap pa yung pagkain, libre Pero in fact, talagang masarap yung pagkain. Kaya lang, sinasabi na lang natin, libre kasi. So dapat, wag ganun yung mentality. Libre kasi, so ang iisipin, baka mumurahin bakuna yan.
Pero pag mahal naman po, mahal kasi.
Nakukuha ng mura ng Department of Health. Kasi nga, maramihan yung bilinan. Pero kung kayong bibili, tingi-tingi, ay talagang tatagain kayo ng presyo. Diba?
Jamie, masagot lang kita. Yun ang ipinaglalaban natin sa PhilHealth sana. Na maibigay na rin ng PhilHealth ang bakuna. Hindi na tayo masyadong umaasa sa mura ba yan, mahal ba yan. Diba? Yun ang isa sa mga gusto nating maging programa ng PhilHealth under the Universal Healthcare Act to cover vaccination. It's very important kasi kung mabakunahan ng mga senior citizen, konti ang ma-hospital, mas konti ang gastos din nila. Kasi sila din ang magbabayad ng hospitalization, di ba?
And that's the mission of the Philippine Foundation for Vaccination from its inception in 2000 to provide equity. Na yung mahihirap, mabigyan ng bakuna na panlaban nila sa sakit. Because otherwise, it's only the rich and famous who will be able to avail of those vaccines that can save lives. Kaya yung mga mahihirap, na sabi nga ni Dr. Atayag, libre hindi nila pagkakatiwalaan. Of course not. That is not the principle of vaccination. And I hope you can ask your own doctors, if they know their vaccination, they should be able, sorry I'm getting carried away. but this is something this is really something that we really have been fighting for. You know, because doctors do not know so much about vaccines. You just ask your doctors. They think they know. They don't. And when we have vaccine seminars, it's always like that.
So well, I'm very impressed and genuine by your commitment. And so, not only passion, but really commitment. Alam yung passion, it wanes. Samantalang yung commitment ni Doktora, I'm sure it's permanent.
Thank you. It's just
Kaya, with that, I would like to make a commitment on behalf of the province.
wow, let's thank you.
Yung ating representative, may representative sa provincial health office, nandito. Matter of fact, pinapunta ko dito ang ating provincial health officer.
You can see.
Ano sa conference?
Can you call her? Or there's the seat
Okay,
there.
at least something that the media, and of course, Dr. Tan, that number one, with regard to the implementation of the EOH program, which anyway, as Jamie mentioned, is free, but they might have some hesitation, our people. We have more than 10,000 barangay health workers, which we will have a program to include this as part of their fund. We give them, all of them, we give them honoraria, I mean, regular. I think we were the first ones who did that, and since 1995, and it's been increasing since then. So we will commit to assist in getting all the people, and we have, of course, 12 provincial district hospitals.
Gov, malaking bagay yun kasi hindi naman naglalakad yung bakuna. Di ba? So, pag hindi ka pumunta sa health center, hindi pwedeng maghihintay lang sa health center. Kaya yung sinasabi ni Gov, binibigyan nila ng ayuda yung mga nagbabakuna kasi pupunta yun sa mga
And we will give them free ride because,
wow,
Doctor, we have for this coming year, we are going to give like vehicles,
Wow.
almost like, we don't want to call it ambulance because it's not complete, but it's really like ambulance for all.
Ako ang swerte ng mga taga-Pampanga.
All the barangays.
Lilipat
We
ako sa
have,
Batangas.
so they are available to the barangay health workers to bring.
Right at the doorstep na.
Yeah. And that's why we're mentioning it to the media because they have to
My God.
let the people know.
That's something. Mobile vaccine van.
Yeah.
Kasi usually, ano,
Another
fixed na
first.
eh.
Mobile vaccine.
Hanapin na talaga.
And on your part, because anyway you have them, just supply us with those, and we will handle that. And then for the seniors,
Yes.
I'm a senior myself. I think I am committed, and I don't have any vaccination, so I will have myself vaccinated.
Yes, thank you.
Yeah, actually that's what we do during national
Although
vaccination.
probably I will not wait anymore until PhilHealth makes it reimbursable. But what are the chances?
Yeah, we usually do the vaccination of our executive officers during vaccination.
Yeah,
No, the vaccination should be part of the reimbursable of PhilHealth. I don't say if the national government or PhilHealth, whose chairman is the Secretary of Health, then I mean, if the Secretary of Health sincerely considers it important, it should be part of the PhilHealth reimbursement. And as I said, the hospitals or the health centers or whoever will qualify it, even the private hospitals, we will, once you have implemented it, we will be the ones to advance the payment, waiting for PhilHealth. At least that is a commitment we can do. But if you include it in your reimbursement, so that, and then we will really have a campaign that all the seniors should have this, not only all the others. So at least you could put that on record. We will advance for the vaccination coming from PhilHealth, so that the hospitals do not have to wait because because they won't be too eager if to buy medicine and to vaccine, and then with that they will be able to buy vaccine also if you include it in reimbursable. Even the province will do it. We will buy on our own. Just to, as we said, we put our money where our mouth is. And I think the Department of Health should also do it. So it's like a challenge to supporting the advocacy of the foundation.
Wow, thank you, Governor. You heard it first from Governor Mandanas of Batangas, right? The first mobile van for vaccination and appealing for reimbursement of vaccines to PhilHealth. That should do it. That should really make people understand vaccine. So, any more last questions?
And we will use the League of Local Governments to really
Yeah, the League of Government. Oh my gosh, this is what we really want from our politicians.
Dr. Lali is here already.
Oh, Dr. Lali, please occupy that seat. This is the City Health Officer.
No, provincial.
Provincial. Please occupy this.
Well, acting, because she is really assistant, but our provincial is not here. So
Yes.
she is now the acting.
So we have only about 15 minutes after 12:30 to have the open forum, but
Yes po, magandang hapon po. Renz Berta po ng DCRH at ng Radyo o sa Batangas. Binanggit po ni Dr. Tayag kanina, isa po sa rason o dahilan kung bakit bumaba ay yung naubusan ng bakuna sa health center. Sa paano po natin mapapalakas yung kampanya kung mismo sa health center naubusan tayo ng bakuna. At isa pa rin po sa binabanggit, bukod sa kumpiyansa, yung dahilan, yung migration. Wala po ba tayong ibang sistema pwedeng gawin para yung sinasabi po ninyo na wala sa listahan ng mga bata na hindi nabakunahan, makinabang po dito sa bakuna?
Okay. Gusto rin nating linawin yan sapagkat kumukuha tayo ng bakuna, mga ilang bakuna sa ibang bansa at sapagkat napakataas ng global demand, kung minsan kailangan tayong pumila at may ilang bakunang hindi nakakarating kaagad. Matatandaan nyo halimbawa yung sa rabies vaccine, nagkakaubusan nun, na problema kami sa Department of Health, nakakatakot makagat ng aso. Kaya nga dapat yung responsible pet ownership nandyan. At buti naman dumating kagad yung mga bakuna. Mga hindi inaasahan to pero nakaplano yun. Kaya nga maintindihan nyo kung bakit may buffer. Ngayon ang inaayos ng Department of Health ay yung supply chain. Malaman natin kaagad kung gaano nakarami yung bakunang naubos, ilan na lang yung natitira, kukulangin ba. So kailangan yung sa local government, ayan si Doktora magpapatunay, dapat alam nila yung mga gagamit ng bakuna parang sa ganon, mabilis nilang na itatawag sa amin na ay kukulangin na kami at dapat ganito. Halimbawa, yung nangyari sa polio, kailangan natin humingi sa WHO, UNICEF, sapagkat wala tayo nung type 2 na oral polio dahil ang naiwan na lang sa atin sa lahat ng bansa ay bivalent type 1 at type 3 kasi eradicated na yung type 2. Eh ang biglang sumulpot sa atin type 2. Kaya kailangan naghintay tayo ng supply bago tayo nag-umpisa ng bakuna. So isang halimbawa yun na hindi available pero ginagawa ng paraan ng DOH. Sabi nga namin, everything is figure out all. Kaya nakahanda parati. Pag nangyari yan, anong gagawin? Hindi naman pwedeng magsisihan kasi hindi ubra yun. Kasi
Okay, Doctor, para
buhay na
magsisihan.
kasalalay eh.
The local government, at least in province of Batangas, pag loan na kami, and we will buy on our own. Kung wala kayo. And we will buy on our own. And you just substitute it with whatever you can get, the same medicine. Because you get your medicine for free.
Hindi
So-
na namin kayo bibigyan ng sakit ng ulo, Gob. Sobra-sobra na yung binibigay nyo. Sisiguran na yung Department of Health na hindi kayo bibili ng sarili yung pera, kundi galing lahat yun sa DOH.
So, let's have a short remark from the provincial health officer
Yeah,
whether
sorry.
you have available vaccines, you know.
Tama po naman yung sinabi ni Bob, kami po sa Provincial Health Office, if ever po nakikita na po namin na out of supply, agad-agad po bumibili kami, kasama na po yun sa aming budget, sa annual investment plan, at saka po sa amin pong mga investment, kung saan po may mga grants din po kami na binibigay po ng mga USAID na willing din po sila na tumulong sa amin. Sufficient enough po, pati po LGU, naglalagi po kami sa mga mayors and they were buying the vaccines.
That's the model province, Governor Mandanas. I wish every governor could follow your footsteps and example. So, any more questions from our
Yeah, but you
panel?
would also ask the chairman of PhilHealth, the secretary, really to push to include vaccination in the universal health care as reimbursable. Because, I mean, to show, to give it really importance to, as I said, to put our vision, our wish into action.
Yeah, this is what Dr. Santiago was saying. We do need all the stakeholders, and what we miss today is PhilHealth and also the Department of Education, because he did say that we need educating not just the health professionals, but even the students. But I guess we should also educate politicians who are still ignorant of vaccination, right? Not the Governor Mandanas, not the province of Batangas, ladies and gentlemen. As you can see, they are so much knowledgeable in vaccine. But there are others who may need those education. Okay, any more questions? Because we have to leave by 12:30. I still have a lecture.
Yeah, okay.
But some of you, any more questions? I know some of you might want to do individual interviews. So,
Ako may tanong sana.
oh yeah, kanina, sorry. One short question from the PMA president.
Hindi, tatanong ko sana, yung si Governor Mandanas at saka si Dr. Shemi. Sino ba rito may vaksina sa inyo? Sa media?
Okay.
One.
Anong klase ba?
So, flu vaccine. Example. Flu.
Yearly yun, flu vaccine. Flu vaccine. PLDT gives all their employees.
Ihingin natin kay
If
Dr.
you're a
Shelley yung
PLDT,
flu
if
vaccine
you're
niya para may injection na kayo ngayon. Kasi magkaroon tayo ng mag-injection tayo, di ba, Dr. Shelley?
Ay, hindi ata.
Di ba?
Yeah,
Si
actually,
Dr.
we still have
Si
that.
Governor Mandala siguro.
Ako magpapagawa
Sorry, we
na
missed that one.
Para, I'm asking this kasi para you could also, share your experience, receiving vaccine, not only to your children, but also to the parents.
Never.
Para it all encompasses all ages. That's the beauty of it. So, parang you'll be increase your awareness or heighten your awareness.
What you're saying is the next front page of the new of the major dailies should have President Duterte being vaccinated with flu pneumococcal vaccine, and that would make it, right? Governor?
I'm willing to be
If you
vaccinated now.
anyone,
Governor Mandala.
Hindi pa ako,
yeah, it's just so bad that we failed. We usually do that, a vaccination during our PNIC. We do that, except today because there were so many things going on. But yes, thank you for that suggestion. We will continue using vaccination during our National Immunization Conference. So with that, let me now end. Thank you very much. Thank you to Shelley, the President of the Philippine Foundation for Vaccination. Governor Mandalas, you have made such a remarkable message today. Please take note of the first that Governor Mandala said. Dr. Magsino from the Mediatrix, our representative, but definitely that was really something. The PMA President, Dr. Santiago, Dr. Eric Tayag, and Dr. Benito Atienza from the Immunization Committee of the PMA, and of course, the Provincial Health Officer, Dr. Magsaka. So thank you, and I hope that, family picture. Do we want them to be standing up? Can we all stand up, please? Yes. And Governor, maybe you can be at the middle with Dr. Tayag.
dito na lang. Sila na lang dyan. Dito na lang ako sa tabi.
Okay, so yay! And the governor. Please, family picture. Marian. Closer. Like a close family ties.
Pwede pong